we are at the M42 main stage. And you know, this is the first year that M42 have hosted a main stage here. And I think you'll all agree it's been a huge, huge success. If you were with us yesterday, welcome back. And if this is your first day with us, please stay on. We've got a whole day of programming, some really exciting presentations, fireside chats, panel discussions, some very important signings that are going to be groundbreaking. We've got so much to share with you. We are at the nexus of technology, sustainability, and health. And M42, well, we're really making a mark here at Arab Health. This, I have to say, I'm a bit biased, is the most exciting stand. Stay with us. We have refreshments throughout the day, smiling faces, and a wonderful tech team to take you through the M42 journey, and lots of collaborators from the international medical field who are going to be gracing our stage throughout today. Now, without further ado, I'm going to hand over to my wonderful panel. Let me just give you an insight. We're going to be doing a deep dive into exploring the genetics of autism, and we're going to be unraveling the complexity of autism. This is really important, and for a very important panel, we've got some very important speakers. To take us through this, I'm going to be handing over to Dr. Fatima Radin, who's going to be our expert moderator. She is the Senior Director, Clinical Development at M42. Please give her a big round of applause. Here she is. It's almost like she was contrasting with me, the white and the pink.
Absolutely.
Welcome on board, Dr. Fatima.
Salam alaikum.
We have our wonderful two speakers who are going to be joining you. Dr. Bijou Abdul Hamid, who is a consultant pediatric neurology at the Mubadala Health Dubai. Please give him a round of applause. And Dr. Azza Atia, the clinical geneticist at M42. We've got a wonderful panel. Please do come on. I'm going to hand over to you, Dr. Fatima. Thank you very much.
Thank you so much. Salam alaikum. Sabah al-Noor. Good morning. How is everyone today? Exploring the genetics in autism. Let's start together. Autism, it's a fascinating topic. Why it's fascinating? Whether you are a scientist, whether you are a physician, whether you are a family, whether you are a children, it's really an important topic. It's touching to children, and children who are really struggling. Then in F42, let's see innovation, let's see clinical genomics, and let's see what we can offer. Dr. Bijou, you have an extensive experience from UK and also in UAE, and you are leading the neuroscience department in Mubadala Health, either in Mubadala Health Dubai or in Danat. Then my first question to you is, what's new? Do we have any additional understanding of genetics in autism? Does this impact your practice? Tell us more, please.
Thanks, Dr. Fatima, for the kind introduction. Now, autism is fascinating. The reason is we still haven't understood what exactly involves autism, because if you meet a child with autism, each child is a child with autism. No two children with autism are the same. So when you see a child in clinic with speech delay or behavioral problems, there are lots of questions which the parents want answer for. The main question that they want is, what can we do to my son or daughter? And secondly, what is the risk of recurrence if I were to have another child?
That's a very difficult question, Dr. Bijou.
And
how you're handling that?
And that's where the role of genetics comes, because we know that the risk of recurrence among siblings is very high. And autism is just a descriptive diagnosis. It's a developmental diagnosis. You can even see it as a checklist. In the Diagnostic and Statistical Manual of Mental Disorders, if you meet the criteria on an assessment, you make a diagnosis of autism. But that doesn't give any answers to the family. The family wants to know what is the reason why my son or daughter has got the problem. And in order to try and understand what might be the problem, that's where genetics come in. But it doesn't stop there, it gets even more complicated because there is no, it's not a condition where, as Dr. Asa will talk later, it's not a condition where one gene causes the problem. It's probably like a multiple dominoes effect. You have a problem with multiple genes, and then somehow the interaction results in the problem, which means that you could take two children with the same problem in the gene, but they might be completely different. They might not have autism. So that's where the complication happens in terms of the effect of the genes, and most importantly, the effect of the environment on those genes. So if you go back 10 years ago, or even like 20 years ago,
You were in UK on this time.
yeah, that's right, yeah.
That's
So
good.
at that time, if we see a child with developmental disorder, then we used to then take a clinical history, as we always do an examination, and then we wonder, like, what is the next thing that I can do? Of course, I can rule out easily treatable conditions like neurometabolic conditions. But then what we used to do is we used to send them for, at the time in the UK, we had the DDD study, which was Deciphering Developmental Disorders study. And then that was looking for like chromosomal duplications, deletions, etc. And sometimes we will get an answer, sometimes we won't. And then fast forward another 5 years, then we had, in the UK, we had the 100,000 Genome Project, where we would then send these children for exome sequencing, gene sequencing. Even then, we didn't have all the answers. And that's where we are now at the cutting edge of genetic explosion. So in terms of whole exome sequencing, and we have gone a step further to whole genome sequencing. And that's where our expertise from our colleagues at G42 comes in.
Absolutely. Let's put two principles, okay? The first principle is real expectation. The second principle, the one that I like, is a maximum hope. Before moving to Dr. Azza, okay? Then, Dr. Azza, tell us more about genetics. Tell us more about the causes of autism. What are the tests that are available now? And as Dr. Bijou was saying, there is no two children having the same kind of autism. Then what's the tool? Is it a predictive tool? It's a lot of questions, but I know that as a professor, in fact, that's your area. Please tell us more.
Thank you, Dr. Fatma. Thank you all for attending this meeting. So, in fact, as Dr. Bijou mentioned, we need first to define clinically the case. So we have two big entities in autism. We have autistic children with other congenital anomalies like heart defect and or problem in learning, problem in hearing or in vision. This is called syndromic autism. And we have non-syndromic autism, in which we have mainly behavioral problems and maybe learning disability as well, but we don't have congenital anomalies. So in the first entity, we usually, or in most of the cases, I would say in 50% of cases, we will find a genetic cause, whether a chromosomal abnormality, like a microdeletion in chromosome 22, or for example, Fragile X. This is a single gene anomaly. So this is the first entity. And in other cases, in the other case, which is isolated, it might be multifactorial. So there is a genetic factor. However, there are other factors which can affect autism, like, for example, if the mother has taken some medication during pregnancy, if the child has been exposed to problems during labor, prenatal problems or perinatal problems, decreased blood flow to the brain can also affect during this area or this time, can also affect the neurological development of the child. So we have a lot of factors, and to define the genetic cause, we need to understand what is the type of autism clinically first. Then comes to the clinical tests which are available. This is the second part of your questions. We have a lot now of genetic tests. We prefer, of course, doing whole exome and whole genome sequencing, which are the biggest panel which can be done. It's a big analysis of all the genes that we have. We have about 20,000 genes. So when we are doing whole exome and whole genome sequencing, we are analyzing those genes, and we are analyzing also the non-coding region. So the genes are the coding region, but in whole genome sequencing, we are analyzing both the coding and non-coding region to define the case.
This is the EGP program,
This is exactly, this
and
is the
I think
EGP
you have
program.
a great number of EGP just now.
Yes,
Just remind me.
We exceeded 500,000.
Can I have an applaud? That's amazing.
So it's helping a lot because defining the reason can help us, first of all, in better management of the child, because each child, as Dr. Bijou mentioned, had a specific approach according to his whole profile, clinical profile, genetic profile, metabolic profile. All of this affect our decision in management. And second, which is the most important part as well, is the risk of recurrence. Because this is the first question that the parents are asking: did I do something wrong during my pregnancy or after even delivery? And the second question: what is the risk of recurrence if I want to have another child? So defining the genetic reason is very important for the child, for the parent, and for the child as well, to prevent the recurrence of such condition. And we have a lot of tests which we can also develop. It's not only about it never stop. So we have the long read now that we are analyzing, which can also detect the expression of the genes, not only the presence or absence of a mutation in the gene, but also the expression of the gene. We have also the biobank in G42, where we can use we can do a kind of biobank for those children to be able to do retrograde analysis and retrospective analysis of these kind of samples, which are very precious samples. Also, analyzing the parent with the child is very important. Trio analysis, doing the child and the Dr. Bijou was mentioning that in NICE guidelines, only children with syndromic autism are analyzed. I would suggest analyzing all children with genetic analysis for all children, whether with syndromic autism or non-syndromic autism, genetically, to identify, at least to understand what are the reasons, and for us to learn as well, because it's a new subject. We need to learn and we need to discover more about the genes of autism.
Thank you, Dr. Azza.
Thank you.
For our audience, you will have the opportunity to ask a lot of questions at the end. Okay. Dr. Bijou, okay. It looks like a complex situation. Okay. For a complex situation, I guess that it needs a multidisciplinary approach and the team. Can you tell us more about, the approach that you are having?
Thanks, Fatima. So you have a child with autism in clinic, and as I said, the parents need answers. Now we know that it is not as a simple case of one gene causing a problem. Like we have a mutation in one gene and then that gene causes autism. Unfortunately, that number is very, 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 very small. In most of the cases, in the majority...
Principle one, real expectation.
True. In majority of cases, it is polygenetic. There are multiple factors involved. Plus, you add the effect of the environment as well. So, in terms of finding the answers, now you resort to genetic testing. And if the parents ask you, like, is there a cure for the condition, then, there is no point in raising expectations. We have to be upfront and say that, of course, given the current knowledge that we have, there probably isn't a cure for the condition. But we can offer a lot to this family. And in order to do that, we need to make the diagnosis. We need to make that diagnosis as early as possible. And like I completely agree with Dr. Assa that, in the past when technology wasn't that, was limited, we were not doing genetic sequencing on all these children. But we really, really need to do that now. Every child with autism needs to have their genes sequenced. The reason is that early diagnosis is key. And along with the genetic diagnosis, we also need to do the assessment and then give that diagnosis, because the child, when it is 3 or 4, and we need to make sure that we optimize the potential for that child, make sure that the child is in the right educational setting. And in order to provide that opportunity for that child, we need answers. Educational authorities need answers. Does this child have autism? What is the etiologic diagnosis? What can be done for this child? And that's where our role comes in. As physicians, the first and foremost, our care should be focused on the child and the family. And it's not a one-man job. We need the clinician, and you need expertise from colleagues like at G42, for example. And that's where the role of the multidisciplinary team comes in. And that's particularly where M42 is really equipped. I mean, thanks very much to our senior leadership for that. Because I see the child in clinic, we suspect that this child could have a social communication problem. We put the child in our autism clinic. We then do the gene sequencing, we do the assessment. G42 comes with the answers, we make a diagnosis, and then we then interact with education. We interact with society, we interact with family, and that happens right at the very beginning. Even when the child is around 1-2 years old, we have already done that, and we have already made huge steps into optimizing that potential for that particular child. But it's not possible with one person, it's not possible with two person. You have to have the entire team behind you, and that's what M42 is really good at, and I'm really thankful for that. Thank you.
Dr. Bijou, looks really like, I think this patient and these children and their family, they have a long path. Okay, it's really a complex situation with a lot of, let's say, diversity and complexity in the syndrome. And it looks like these families are going to a lot of specialists, psychologists, behavior therapists, learning issues, coming to you as a pediatric neurologist, and then potentially one day you will order, a test, a genetic test. And when you have a confirmation, do you see a relief? As a mom, I think that that's important, that I have a confirmation after a long way that I went to this one, saying maybe that, maybe this, maybe that. Is it a relief for these families as well to have an answer one day?
Absolutely. A closure is very, very important. Even when the family realizes that there isn't a cure, at least if they answer that, okay, your daughter or son has got this problem because we have found this mutation or this spelling mistake in this gene, and we can say with reasonable certainty that this might be contributing significantly to your child's problem. And that closure is very important, because up until this diagnosis is made, this family is in turmoil because they don't know why he is not speaking, why he is 3, 4 but still not speaking, why his behavior is so repetitive and restricted. And those answers, and giving them an answer, I know for a fact that speaking to families, that closure is very, very important. And up until last 5 years ago, we were not able to give that answer. Of course, we would say okay, your daughter has got autism, but why? What is autism? Just a label. So in order to try and find answers for that, if we can then help those families and travel the journey with them, that's a fantastic thing.
Absolutely. And I think, Dr. Azza, also, you're doing counseling for families. Tell us more about your discussion with these families.
So I think the most important point in the discussion is that it is not the mistake of anyone. This has to be understood. We need to give time for them because they will pass by a certain time of denial in the beginning, and then they will start to accept the condition and they will start to deal with. And that's why we need also psychologists in this team, because they will support them psychologically. And then come the diagnosis when we have a clear answer from the genetic test. As Dr. Bijou said, this is a kind of relief for all of us, not only for the parent, because we can at least advise them for the next pregnancy, and we can deal better with the situation itself. So it's a long way of discussion with the parent, a lot of questions, and they might ask them in different sessions because in the beginning they have a lot of questions coming in their mind, and that's very important to take it all and to reply to what we can reply to, because of course we don't know everything today as well. We have to be realistic. We have to be to give them what is the expectations that they would know from us. Moreover, I would recommend doing the genetic test every 2 years for this child if the first results come back negative. Because maybe in 2 years we will discover other genes, we will discover other factors which might explain autism. The problem is when the results come negative. It's not when the results come positive, I would say, because the parents still ask why it happened. So I think a continuous follow-up, it's not only one visit, it's multiple visits. They should see at least the geneticist once a year, and they will follow up with a neurologist every 6 months or every 3 months, and then every 2 years would do the repeat the genetic test if the first one is negative.
That's a great. Thank you. Dr. Bijou, okay, one more question, please. With G42, we're having the genomic part, but we're having also the AI. Does this help?
Absolutely, absolutely. So that's where the cutting edge technology comes in. Now, AI can be very, very significant in this particular aspect in terms of the early diagnosis, in terms of like predictive behavior, in terms of contributing our data to the wider research. All these where artificial intelligence can come in, particularly making predictions in terms of, so all this data that is being generated by G42 is then contributing to the language, and from that language database we are learning further. So if the key to making a change to a child's life is early diagnosis, and that's where we can leverage the strength of AI. And that's very important because the amount of data that is being produced by the genetics is massive. And there is no way that, without technologies like AI and machine learning, we can then make some sense of this data that is being produced. So that's where the AI has got a particular relevance in terms of autism or other neurodevelopmental disorders.
This looks amazing. Do you agree with me to listen to clinical and the clinician, okay, that I'm sure 20 years ago, I'm sure we will never speak about AI, but today we speak about clinical. At the end of the day, he still do medical history, and he still, in fact, need to examine and assess his patient. But in the same time, Dr. Azza can support from a testing and genetical testing. She can counsel. He can have a multidisciplinary approach. And on the top of that, you have an AI and research with a hope for the future. Okay, I feel amazed. What about you?
Absolutely, and for example, it's not just the genetics. For example, now if you look at the current waiting list for a child to be diagnosed with autism, to be referred to a clinic and being seen, currently my understanding is that it runs into several months. For example, if a child is referred to you at age 2 with a problem with social communication skills or language, by the time that child is seen and made a diagnosis, it's already 3.5, and then we've missed the boat. But that's where AI comes in. With the current technologies, even there are FDA-approved AI technologies where using home videos and using other data, using AI, we can then reliably make a diagnosis of autism quite early on, quite quickly, which means cutting this waiting list, making a rapid diagnosis, and then making sure that the patient can be sent on their further journey to the other support team. And that's really fascinating because they are already FDA approved autism, AI-based autism diagnosis already there, which can then analyze patient home videos, etc., and then give a reliable suspicion that this child could have autism, and then we make that diagnostic process faster for the families.
I think you are more with the second principle of maximum hope, Dr. Bijou. I agree with you. Thank you so much.
Thank you.
Then I would like to ask the audience if you have any question to our speakers.
Hello. Thank you so much for the well-introduced part of your diagnosis. But what kind of solution you have now for the parents? What are you doing afterwards to get the autism better? And maybe I think you have to do some treatment because I'm holistic therapies from Europe, and maybe it would be kind of working on the extracellular base to keep on moving with the extracellular matrix or some ingredients who are working on the alpha brainwaves.
No, absolutely. Now, you're right. Like once you have a diagnosis of autism, and in the past, like 5 years ago, when we used to see children in clinic, we will invite the family back for a diagnosis, and we will have some printed leaflets ready, like in terms of like, these are the special schools around the region, these are the nurseries around the region. We give that bump to the family and they go home with it. But things have changed. Now, like you said, like, there are more and more research happening in terms of like, what is the relation with the gut health and autism? What is the relation between heavy metal exposure and autism? What is the relation with, is there any role for stem cells or cell therapy for autism, etc. But at present, those are all in the research phase. But rather than like hoping that this magic cure will happen at some time, there is plenty that we can do now. Making that early diagnosis, plugging that child into that support network, which includes psychotherapists, behavioral therapists, speech and language therapists, occupational therapists, physiotherapists, neurologists, physicians, geneticists, genetic counselor. We have already made a big difference. We don't have to worry about the cure. We are managing the condition. We are improving the quality of life for that child and the family. That's important. And I'm sure, like, inshallah, like things will improve. We will. Maybe 10 years, 20 years, we will have a solution for this. We will have a magic cure. But up until then, we still need to look after these families. That's very important. Quality of life, important.
Just
Absolutely.
to add to you, okay, M42, we offer also a community-based, team, and we have a lot of work to offer, in fact, support for the families, even to be inclusive in school. We have therapists who go to school and support them, learning disability also. Okay, we have a large team who support them as well. We are welcome, okay, to additional support and to exchange. I welcome you potentially to speak with our team and to have additional potentially collaboration on that. Thank you so much. Any more questions, please?
Thank you for this beneficial symposium. I want to ask if there is any drugs during pregnancy can be avoided or can cause autism then?
Sorry, what was the question again?
Is there any drugs during pregnancy can cause autism?
Yes. The most important drug is sodium valproate, for example. And sodium valproate is the key drug which has to be avoided during pregnancy. The reason why I mentioned sodium valproate is that's a drug quite widely used in epilepsy. There are also other drugs like thalidomide, for example, but that is no longer used. It used to be used for increased vomiting during pregnancy, but sodium valproate, and that's the reason why there are now government issued directives on the use of sodium valproate in females of the reproductive age.
What's about luminal? Luminal.
What's it?
Phenobarbital.
Phenobarbital, the indications for phenobarbital in adults is much less now. So in terms of anti-epileptics, like the incidence of use of phenobarbital is much less. Sodium valproate still remains the major issue.
Thank you so much, Dr. Bijou. Thank you so much, Dr. Azza. Thank you to all our audience. I apologize because we have another, in fact, panel coming, but our speaker will be here for any additional comment. I want to add saying that we offer maximum hope, real expectation, but principle too is really, maximum hope. I want to share with you, okay, what one of our colleagues was posting in my LinkedIn when I was sharing, in fact, the invite of our panel. Dr. N, so impressed at this inclusion. As the first female CMO in the country and the mother of an autistic child, it may be beneficial if this reflects diversity and inclusion. I hope that we are today, okay, answering to Dr. N answering to you colleagues, but also offering help and support and continuity for families and patients. Thank you so much. Thank you.